Hello everyone, my name is Kanae Durrell. On behalf of the American Association of Nurse Practitioners and the National Nurse-Led Care Consortium, I would like to welcome you to today's webinar, introducing the National Rural Accountable Care Consortium to discuss their role in transforming clinical practices initiatives, the TCPI, funded through the Centers for Medicare and Medicaid Services, CMS. For those of you who are unfamiliar with us, AANP and the National Nurse-Led Care Consortium have joined in partnership to form a nurse practitioner support and alignment network as a part of the TCPI, and we are working with practice transformation networks such as the National Rural ACC to enroll clinicians and their practices into the TCPI. The information presented in this webinar or its contents and conclusions are those of the presenters and should not be construed as the official position or policy of CMS or the U.S. government. Although this webinar is presented as a part of the TCPI, it does not necessarily reflect the opinion or position of CMS. Today's webinar is being recorded and will be available on our website in the next week and at www.healthcarecommunities.org under the Nurse Practitioner Support and Alignment Network. If you haven't already, please feel free to browse this website and join our NP stand. All participants will be muted throughout the presentation. I encourage you to submit questions throughout the presentation. Please use the Questions tab on your GoToWebinar control panel, as seen here, to ask your questions. It will be relayed to the presenters and answered at the appropriate time. Before I introduce you to our presenters from National Rural, I would like to give you a brief overview of the TCPI and the nurse practitioner's role in this work. So the Transforming Clinical Practices Initiative is an initiative funded through CMS, and it's the largest initiative for transforming practice that has received federal funding. The TCPI is structured by PTNs and support and alignment networks. The practice transformation networks are peer-based learning support networks to over 140,000 providers. They will be providing quality improvement tools and technical assistance support, and you can see some of the examples of what they will be providing here. The Support and Alignment Networks, which is what the National Nurse-Led Care Consortium is, will help to support the PTNs in their work by funneling clinicians into PTNs utilizing their membership network. You can see here how FANs will work in collaboration with PTNs in support of their work. And the Nurse Practitioner Fan is a partnership with NNCC and AANP. We are the only fan committed to enrolling NPs so that NPs can have a voice in the change that is coming to practices in the areas of payment reform. Our goals are to raise awareness amongst the NP community about the TCPI, to recruit NPs into the PTNs, provide educational content free of charge to participating providers and practices, and develop emerging TCPI-related content. If you would like to participate in the TCPI, please do not hesitate to contact myself. My email address is there, or Chantel DePace from AANP. Her email address is there. You can also go to our NP Stand landing page to learn more information about us. And you can join our NP Stand portal page to receive updates on TCPI milestones, PTN offerings, and educational opportunities with CEs for NPs at www.healthcarecommunities.org. Now we're going to pass the mic to our presenter. Her name is Joanne Ort from the National Rural Accountable Care Consortium, and she can introduce herself.
Hi, thank you very much, Kanai. My name is Joanne Ort. I'm one of the regional vice presidents with the National Rural Accountable Care Consortium, and I really appreciate the opportunity to speak to you today about our Practice Transformation Network. Next slide, and actually you can, next slide. Go ahead and go to the next. Thank you. So I just want to give you a little bit of background about the consortium. The National Rural Accountable Care Consortium, a not-for-profit organization that supports rural healthcare transformation. We were awarded up to a $31 million TCPI grant in 2015 to assist 525 rural health systems in preparing for value-based payments. The National Rural ACO, our sister company, actually began in 2014 operating their first accountable care organization. We have 24 in place for 2016, and so we have a lot of experience over the last few years with developing programs and services to address value-based payment. Next slide, please. This is our triple aim, which is very similar to other organizations' triple aim. We focus on providing better care for the patient, lowering per capita costs, but we also develop programs and services that will help organizations improve their financial performance. Next slide. Actually, you can skip the next one too. So this is a roadmap for our Practice Transformation Network. There is, in the pink box, no cost to participate in this program. We will help you establish a billable care coordination service, set up a framework to manage for population health, doing a lot of the quality improvement and care coordination will help you qualify to become a patient-centered medical home. And then lastly, to increase revenue to preserve the practice's future. Next slide, please. To be eligible for this program, you can be a physician, a PA, or an NP. It's probably easier to talk about what makes you ineligible to be in this program. If you are already in a Medicare Shared Savings Program or CPCI, then you are not eligible to participate in the TCPI program. Next slide, please. So this is a 4-year project. It focuses on Medicare fee-for-service beneficiaries and ambulatory practices. Clinicians can join this project at any time during the 4 years and will have a rolling implementation plan in place. There's also absolutely no penalty to leave the project. If you start the project and decide it's not something for you, you can actually leave with no penalty. The first table on this particular slide are the enrollment goals that we had submitted to CMS when we wrote the grant. So essentially, over the 4-year period of time, we agreed to assist over 500 communities and over 7,300 practitioners. On the bottom table, this is our current statistics as of March 2nd. We've recruited over 160 sites, over 1,900 primary care practitioners, over almost 1,400 specialists, for a total of 3,380 practitioners. Next slide, please. As far as participation requirements, because we are setting up a care coordination program, we ask that the practices, at some point during their time with us, appoint an in-house care coordinator. And then other than that, that the participants participate in our training webinars and our quality improvement workshops. Next slide, please. This is a matrix of our educational program. It's delineated by job responsibility, essentially. So as you can see on the matrix, the executive leadership, we have a webinar series, and we ask that the executive leadership participate in the orientation webinar. And then we also hold a monthly cohort call for the executive leaders. And the monthly cohort call provides program updates and policy updates and also some sharing of best practices. In addition, we'll have an annual delivery reform workshop that we ask the executive leader and also the lead clinicians to attend. The practice managers, again, the webinar series, and actually the practice manager, the care coordinator, very similar. We have a webinar series. They run about 1 webinar per month. They're about an hour long, very topic specific, and they are live and recorded, and so you can participate live or actually go back and listen to the recording many times as you want. We have a quarterly quality improvement workshop that we ask the practice manager and the care coordinators to participate in. At those workshops, there's a didactic session and then a work session where the practice manager and the care coordinator will actually lead with a work plan that they can take back to the practice and implement. Each of those folks also end up with a monthly cohort call, so one specific to the practice manager and one specific to the care coordinator. The rest you can see. Of the IT staff, there's a little bit of work for them. And then the lead clinician, again, they have a series of evidence-based medicine webinars that we ask that they participate in, and also ask them to join in the annual delivery reform workshop. Next slide, please. So as I mentioned, the foundation of our program is helping to set up a billable care coordination service. And to do that, we ask that the practice identify someone that can be trained as a care coordinator. This person can be either an RN, LPN, medical assistant, CNA. We offer a 26 online self-paced course that the person will go through so that they're learning how to do care coordination. In addition to that, we have care coordinator coaches on staff, and a coach will be assigned to each care coordinator. This all culminates in a workshop where the program is actually offered through the Iowa Chronic Care Consortium. At that program, they'll complete their training to become verified in competency as a clinical health coach. In addition to that, to do care coordination, you also have to have access to the care coordination plan electronically 24/7. And so we work with a company called Lightbeam Health Services. They have a module in their, this is a data warehouse product. They have a number of different modules that we'll use in the TCPI program, one of which is care coordination. And so the module will help develop care plans, track the patient's progress, and also document the work for care coordination billing. In addition to that, we also offer access to a 24/7 federally funded nurse advice line. And so this is available, again, to your Medicare fee-for-service patients. And it works very much like you would assume. The patient's educated to call that number after hours, on holidays and weekends. And the nurses triage the patient, trying again to avoid any unnecessary trips to the emergency department or to specialists. The following day, after a conversation transpires between the patient and the nurse advice line, the practice will receive a report describing what occurred so that the practice can follow up with the patient. This care coordination service is actually billable at $42 per member per month. And so each beneficiary that's enrolled in this program, that's about an additional $500 per year in revenue. Next slide, please. We also work with your practices to help redesign the managed for population health. By this I mean we take a look at, and again, a lot of this work occurs in those quality improvement workshops, to identify gaps in clinic workflow. So we'll help train the front desk to make sure that they're coding for all the diagnosis codes that apply to a patient, and also following the appropriate protocols to ensure that the patient is getting their annual wellness visit and their preventive screenings. In addition to that, we assist practices in quality reporting. We'll be using the 7 ambulatory quality metrics that are affiliated with Accountable Care Organization quality metrics. These include medication reconciliation, fall screening, colorectal cancer screening, influenza immunization, pneumonia vaccination, BMI screening, and clinical depression screening. We also provide each practice with a tablet that has a patient satisfaction survey loaded on it so that this can be provided point of care. And then the practices can receive almost real-time feedback with regard to their patient satisfaction. Plus, they'll receive a monthly aggregated report as well. Next slide, please. So working with us on implementing care coordination, improving quality metrics, and participating in the educational programs, as well as developing plans to close clinical workflow gaps and become more efficient, will help practices qualify to become accredited as a patient-centered medical home. And as you know, patient-centered medical homes also receive additional bonuses under the new payment models. Next slide, please. Again, you know, we also have that objective of helping you to increase your revenue so that you can preserve your future. So by increasing patient satisfaction, implementing care coordination programs, what we've seen with our accountable care organizations, this has resulted in an increase in local utilization, and thus an increase in revenue for the practices. In addition, a lot of the activities that increase the quality scores, like the annual wellness visits, smoking cessation counseling, obesity counseling, chronic care management, and advanced care planning, also help generate additional revenue for your practices. In addition to all of this, we also, as an organization, will be helping to educate you about what the right advanced payment model is for your community. And so through the educational program, we'll keep you abreast of any changes that are occurring with Medicare with regard to APMs, any new models that are coming out, as well as the existing ones. We also, as an organization, are going to be working on developing statewide clinically integrated networks. We have a professional negotiator on staff who's going to help develop value-based contracts that generally pay additional, these are focused on commercial payers for the most part in Medicaid managed care, to pay additional dollars for chronic care management. They usually have a quality reporting and a bonus component, and sometimes an additional shared savings component. So this, again, is something that's available for folks that are working with us on TCPI, but nothing that is mandatory. Next slide, please. So with regard, there are two types of data that will actually be collected during this project to help focus the practice's activities in the National Rural Accountable Care Consortium's TCPI. So the first one is a practice assessment, which asks about processes and systems in place in your clinic. And then the second one are the quality metrics that I mentioned that focus on wellness and preventive care. Next slide, please. So the practice assessment is conducted within 30 days of enrollment. This is a coaching tool that's used to see what your practice is already doing well at and the areas where you're looking to further develop. This will help us know what resources will be most useful to you throughout your time in TCPI. The practice assessment is a tool designed by CMS that is completed by every practice in a practice transformation network. The primary care practices complete a 27-question tool, while the specialty practices complete a 21-question tool. Typically, these assessments take anywhere from 45 to 60 minutes to complete. Each question asks you to score yourself in alignment with processes in place at your practice. The questions align with 7 areas important to healthcare reform, population health management, and experience with value-based payment models. The table on this slide, which I'm sure is probably a little tough for you to see, holds examples of the questions included under patient and family engagement. The assessment is repeated every 6 months. The regional quality improvement organizations, who are an important partner for QI assistance with this project, will also participate in the assessments. This provides an immediate and local link to additional resources as well. Next slide, please. In addition, we'll be working with clinical quality measures, as I mentioned. These will be collected throughout your time in the TCPI project. The measures are selected to be applicable to many patients and emphasize wellness. So your practice's participation in TCPI will begin with participation in a QI quality improvement workshop that focuses on incorporating these practices into your workflow. Next slide, please. So this slide really just shows the our strategic plan for transformation. You start at the bottom of the stairs in TCPI, which I like to refer to as the training wheel program to prepare for value-based reimbursement. From there, you can move on into a clinically integrated network if you so desire, and from there also into ACOs or some type of Medicare shared savings program and beyond. Next slide, please. So just to summarize the Practice Transformation Network program, there is no cost to participate in this program, and there's no penalty to withdraw. We will provide assistance to help you set up a billable care coordination program that includes a self-paced 26-hour online program, a coach for your care coordinator, a 24/7 nurse advice hotline, access to Light Beam Health Service that has a number of analytic modules included, a care coordination plan, there's a risk stratification module, and also a quality metric dashboard, as well as a number of other modules. We provide access to quarterly quality improvement workshops. These are focused predominantly for the practice manager and the care coordinator. And then we provide a very robust education program, monthly webinar series, topic-specific, monthly cohort calls for executive leaders, practice managers, and care coordinators, webinars for everyone, including clinicians, and for the clinicians, they focus on evidence-based medicine topics. And then an annual delivery reform workshop focused for the executive leadership as well as the clinician. Next slide, please. And so our application and participation agreement are online at the nationalruralaco.com. Those documents are a good example, a good summary of what we are providing to the folks that join our PTN, as well as the expectations for the participants. So a good place to start in terms of finding additional information. And with that, I will open this up to any questions that any of the participants might have.
If you have any questions, you can type them in the question box. Okay, so we have a question. We are a sole practice with only one nurse practitioner. Do we have to have an MD or DO oversight?
To participate in this program, you do not have to have an MD oversight.
Our next question is, how long does it take to hear back from the application? So once they've submitted the application, how long does it take to hear back?
We have a really quick turnaround time, and so we try to turn that around within 5 business days. And the application, understand the application, unless you are, like I mentioned, in a Medicare shared savings program, the application is more of a formality. And so we accept all practices, regardless of size, whether they're urban or rural. So we have a number already that are enrolled that are sole practitioners, as well as larger group practices.
What is the definition of rural?
So for this particular project, we are not tied to any definition as far as rural. I know that I used rural a lot in my presentation, and that is in our company name as well, and that's because our roots came from rural providers. But for this project, there is no rural designation. So anyone can participate no matter where you're located.
Do clinics have to have a certain percentage of Medicare patients?
They do not have to have a certain percentage of Medicare patients.
And the next question is, will the slides be made available after the webinar? I can say that the slides will be made available on the National Nurse-Led Care Consortium's website, as well as the Nurse Practitioner Support and Alignment Network website. Joanne, is there anywhere where participants can go to view the slides on your website?
No, I don't have those loaded on our website. However, we do have another informational webinar that is there, and the slides for that are available. And so that's at the National Rural ACC.com.
And we'll also be sending out a Vimeo link to participants, those who registered for this webinar. We have another question. Do clinics have to be affiliated with a local hospital?
No, they do not have to be affiliated with a local hospital.
Our next question is, how do we know what patients to enroll?
As far as care coordination, so all of your Medicare fee-for-service, there's no enrollment with regard to the program itself. For care coordination, you'll go through a learning process. You know, we will teach you all the intricacies to care coordination and make sure you're setting everything up well for that. But the bottom line is, to qualify to be enrolled in a care coordination program, you have to have at least 2 chronic conditions. It's not an automatic enrollment, so there has to be a conversation between the clinician and the beneficiary. The beneficiary has to agree to participate in the program.
Great. This person wants to know, who can they email with further questions? They unfortunately weren't able to see the beginning of the program. They are a very small NP-owned rural clinic for profit. Will this benefit them financially, and will they have to hire extra staff?
We tried, number one, they can email me directly if they have questions, and my email is jort@nationalruralaco.com. Trying to think, financially, will this benefit them? I'm not sure I have I would hope so. Let's see, they also asked, I would hope it would benefit them financially, but rural health clinics have a little bit different reimbursement model, so I can't answer that specifically. Again, it's something where in our workshops we try to have some experts on site that can help answer some of those questions for you. With regard to hiring somebody, we really tried to put this program together so that you would not have to hire additional people. So as far as the care coordinator, you know, our recommendation is to try to identify somebody who already is in your practice to be trained to do that work.
Also, if you're interested in joining the TCPI and would like a direct connection to the National Rural Accountable Care Consortium, you can email myself, Kanae Duro. Our contact information is on the screen. It'll also be available in the slides. Or Chantel DuCape. Her contact information is also on the screen. We have another question. Does the care coordinator need to be in-house, or can it be an RN, LPN, CMA that works from home?
Oh, they could work from home. That should not be a problem.
We have a participant who's starting a practice in May. Can they join now?
Yes, they could absolutely join now if they would like.
And is this only for Medicare patients?
This program, yes, is only for Medicare fee-for-service patients. Now, we do have with the NurseWise hotline, if people wanted to extend that out to their total population, they could, but there's an additional charge for that. So the grant funding focuses on Medicare fee-for-service patients.
Great. I think that's the end of the questions that we have so far. If anyone else has any further questions, you can contact Joanne or you can contact myself, and we'll be happy to answer those questions.
And just one more reminder that we will be sending out the link to this recorded webinar along with the slides to participants in the coming days, so take a look for that.
Thank you for participating in this webinar, and this concludes our session.